Well, welcome to the COVID-19 update. It's Thursday, the 9th of April. And of course, the Easter holiday is coming up. It's an Easter bank holiday, so happy Passover, happy Easter. And maybe like me, you were looking forward to having a few days downtime, maybe a bit of relaxing in the countryside. Well, unfortunately for most of us, this is not going to happen. Now, people often ask, well, what harm am I doing going for a walk along the beach or going for a cycle out in the country? And the answer is, on an individual level, probably not very much. But the point about these public health interventions that we are now having to live through is that they are population level based interventions. So there's an interesting example of David Clark, who I'm not picking on particularly, but he was the New Zealand health minister, so really he should have known better. But he drove 20 kilometres. I think he had his family with him and just thought I'd have a day on the beach, which is very nice. So if David Clark and his family go for a day on the beach, they stay in their family household group and then they drive back, then they're not doing any harm. That's true. They're just mixing amongst themselves. But he's not an individual. He's part of a population. And what he does depends on everyone else, and everyone else depends on him. So if all of the population of New Zealand decided to go to the beach, then there would be a problem. Then there would be mixing. So this is the whole point about these interventions. They have to be population level. Because I have to take responsibility for your health. You have to take responsibility for my health. We're in this together as a population. We're not individuals at the moment in that sense. Now, I'd like to put good news in here whenever I can. So the World Health Organization has said that 60 teams now are working on a vaccine, 60 teams around the world. And to give one example, in South Korea, they're working flat out on a vaccine. South Korea's got a very extensive biotechnology capacity. So they're talking about leading and sharing. Now, I know there's a vaccine in my country. I know there's several in the United States. I know there's one in Israel. I know there's lots of different vaccines. But what encouraged me about the South Korean position was they are collaborating between the private and the public sector. They're allowing private sector scientists, presumably from the pharmaceutical industry, to work in public laboratories. They're giving them the full facilities, so they're making antibodies available, they're making blood samples available. It's all together, and they've committed to share this with the World Health Organization and the United Nations. So this is for everyone. So this is a good example of the collaborative, cooperative approach we need. We need to share this data with the whole world. It's not a matter of who gets to the vaccine first and makes a lot of money. Let's hope that approach keeps up and that other people follow South Korea's example. Now, yesterday I talked about a very disconcerting point about African Americans being affected more than white Americans, and there does seem to be data emerging now that black people are getting more complications of the disease on a global scale. Now, this is partly because certainly in a lot of Western countries, people of Afro-Caribbean descent often have more comorbidities, so they're more prone to things like hypertension, and we know hypertension seems to be a factor in this disease. So there is this comorbidity thing. But if you have dark coloured, in fact, well, anyone, but if you've got dark coloured skin especially, I would suggest you consider your vitamin D status and try and talk to local doctors about that, because I think that's a factor. So I would appeal to all local doctors really to think about the vitamin D status of your patients, because it does tie in so well with the data that we currently have. Now, correlation doesn't mean causality, as we're always saying in research, but it's such a simple variable that's so easy to correct and could potentially, in my view, save lots of lives. Now, I'm not a politician. I did think about going into politics once, about 15 years ago, for 2 or 3 minutes and rejected the idea. So I'm not a politician. But it was disconcerting to notice that Professor Ferrari had resigned from the European hierarchies of science after just a few months in post, and that was concerning. So whatever's going on there, I just hope they're going to get their act together. But sad to note that a man of Professor Ferrari's calibre is no longer officially working as an official scientist for the European Union, although I'm sure the professor is absolutely flat out working on this problem, and in fact I'm pretty sure he is. So just reminders, this is more contagious than seasonal flu, COVID-19. The virus can live on hard surfaces for 3 days. Person-to-person transmission is mostly via droplet and in the air, but always remember surfaces as well. And what people sometimes forget is that this can be transmitted in stools as well. So excellent toilet hygiene is required. Now, we have talked quite a few times about why some people are more affected than others. And we've talked about black people versus white people, or it's not that simple, it's a gradation in skin colour, of course. That darker skin makes vitamin D more slowly. But the other that's been discovered, and I might do a separate scientific talk on this, but just to notice in passing now, that there is genetic variations in the ACE2 receptor. Now, the ACE2 receptor is this receptor in the lungs into which the virus fits. So the virus gets into the body by fitting into this ACE2 receptor. And there does seem to be genetic variation in the shape of this ACE2 receptor that means it can fit better or not so well into this receptor site. Now, this is not a racial difference. These are differences that are between individuals. So this could explain why some individuals get the condition more severely and some others less severely. But as I say, we'll look at some science of that in more detail another time. Now, going on to specific places, Thursday the 9th of April. South Korea, I'm going to start with some good news here. So South Korea, 39 new cases. This is a great reduction in the number of new cases in South Korea. And 10 of those were imported, meaning there was only 29 cases of community transmission in South Korea. So this is very encouraging. And their curve has been flat for quite some time now. So South Korean measures are working. And I think the key to the South Korean measures is they've been targeted, precisely targeted to at-risk people, at-risk individuals. It's been a very specific, targeted approach. And we've always said this is what we need. We need the top-down lockdown to be going on with, but we also need this bottom-up, precise approach to pick away at the bottom of the pandemic. And that's what the Koreans, South Koreans have been good at. North Korea, I still haven't heard any data. I think the North Koreans are just, well, who knows what happened in North Korea. It's a tragic, terrible situation. I've read no data from North Korea at all, but I think things are probably quite bad there, unfortunately. Deaths in South Korea, 204, 1.95%. Now, this is based on fairly good data and quite reasonable levels of testing. So it does make you think that this could be kind of round about the case fatality rate that we might be looking at in some places. A lot higher than we'd hoped for. In fact, it still might be artificially high because of the undiagnosed cases in South Korea. And we know that there are many undiagnosed cases in South Korea. So still much higher than we would hope for. And I am hopeful it is going to come down, but that's based on pretty good data. So that's just a figure that's a fact. Good number recovering in South Korea. So good to see. Now, New Zealand, another interesting success story, really. Now, there's 1,239 cases, but this is confirmed and probable cases. And the probable cases are diagnosed clinically. So they're quite good there, really. And we'll see that the curve is well and truly flattening out in New Zealand. Only one death reported so far, and that was today. That was today, Thursday, in New Zealand. Now, obviously, there's going to be more. But it does indicate that the authorities in South Korea acted fairly early, because, as we know, there's this lag time in deaths. So Prime Minister Ardern has said that without the interventions, they would be on a similar trajectory to Italy and Spain. But because they've acted relatively early, now this is interesting. This is the number of new cases. So this is today, Thursday. The data I've got, I'm not quite sure about this data, but as far as I know, it's 29 new cases. Now, these other data are confirmed. So Wednesday, there was 50 new cases. Tuesday, there was 54. Monday, there was 67 new cases. So we see the number of new cases is going down quite dramatically. And if they keep it up at this rate, then those number of new cases is going to go down to zero. The people that have the disease now, well, some of them tragically will go on to die, but others will make antibodies and will recover. So it's quite possible that New Zealand could eradicate this infection. That is quite possible. That in New Zealand, an island situation of course, but it could be eradicated. And interesting to note they're doing 9.7 tests per 1,000. Now that's not the best in the world by any means, but it's middle of the ranking for developed countries. But it looks like those tests, as in South Korea, have been well targeted to where they need to be. So it is partly the number of testing, the amount of testing, of course, the overall amount of testing, but it's the targeting of that testing that's important as well. So remarkably encouraging there from South Korea, both on the scientific collaboration vaccine development stage. So, I mean, this could potentially mean a vaccine early-ish in 2021, which would be marvellous. Now, Austria is another interesting country. Again, relatively good news, but not unqualified. Over 13,000 cases. Death rate in Austria, 2.3%. So again, not too far off what we're seeing in Korea, really. Korea just under the 2%, wasn't it? Austria just over the 2%. The thing about Austria, of course, advanced country, sophisticated data. Many undiagnosed cases, of course. There's way more cases than this. But then again, people are dying at home, so we're still round about that mark. We really don't know yet. Full lockdown, it's been strict in Austria for about a month. Borders remain closed to foreigners. The testing is fairly good, 13.7 tests per 1,000 people, 120,000 tests in total. So reasonable testing there for a developed country. Now, all these testings are abysmal, of course. They should be way higher, but all we can do is compare with what we have at the moment. Now, they're talking about opening local small shops next week. So they're not talking about lifting the lockdown, but opening small local shops next week. That's what they're talking about after a full lockdown for a month. So it just shows how important it is to really clobber the figures right at the start, as Austria largely has done. But education remains closed, schools, universities closed, public gatherings still banned. And this is interesting, and we've looked at this in detail in the last couple of days. Masks obligatory in public spaces like supermarkets. And we've looked at data that shows infected people spread the virus much further distances than we've thought. So wearing masks in public, in supermarkets, for example, in Austria, I don't believe it's going to protect me from getting the virus as an uninfected person. But I do believe if I'm an infected person, it's going to reduce the chances that I give it to someone else. So we wear a mask for everyone else. We wear a mask for everyone else to stop me infecting you. And I think other countries are going to have to start thinking about this because everyone has to shop for food. And it is a weak point in our lockdowns at the moment. Now, the United States, numbers are huge, but testing is greatly being ramped up in the United States. New York, another 779 deaths in the last 24 hours, making 4,571, and that is just in the city of New York. So over 4,500 deaths already in the city of New York. Now, 86% of these deaths in New York had underlying health conditions. So that's, I suppose, roughly what we would expect, underlying health conditions. So we've known for a long time that people with comorbidities, chronic diseases and increasing age are more at risk. And that's been borne out by the New York data so far. Now, lockdown measures are starting to work in New York area. This is just the New York area. Hospital admissions are levelling off. So, promising signs in the New York area. As there were in California. Just a pity that the United States has a bit of a disparate response from state to state. Now, I have got this statistic. This is from Oxford University, so I'm sure it's fairly reliable. The United States has ramped up their testing massively from a virtually non-existent start that we did talk about before, but that's history now. So at the moment, as of yesterday, as of the 8th of April, in the United States, they've done 6.61 tests per 1,000. So well over 2 million tests. And in terms of the number of tests conducted, the United States is leading the world considerably. But of course it needs to, because it's got a large population. And this will carry on increasing, I have no doubt, but it needs to increase massively further. Now, places like Wyoming, New Mexico, still relatively unaffected. But if you live in those states, bear in mind it is coming unless you are very strict in your social distancing, physical distancing, lockdown measures. Unfortunately, it is going to spread all around the United States of America. More rural spread. So rural America is being affected now. 2/3 of rural counties in the United States now have cases. Now, there was an election in Wisconsin a few days ago, which basically descended into farce, but one which could result in deaths, unfortunately. And I'm not sure about this, but I think you've got something planned on November the 3rd in the United States, haven't you? There's some event planned then. So clearly there's implications for the presidential elections on the 3rd of November. We don't know what things are going to be like then, but certainly the campaign leading up to that is going to be greatly affected. Now, as we predicted anticipated a long time ago, institutions and nursing homes being badly affected in the United States, as they are all around the world. We saw that village in Italy yesterday where 1,900 people in a village in Italy near Rome were in total lockdown because the cases spread from an epicenter, a localized epicenter in the nursing home. So just a few things that caught my eye from the news. In Pennsylvania, there's a facility with 450 residents and 300 staff, and they're all presumed to be infected. So that is an epicenter in its own right in that one care facility. Massachusetts, the National Guard have been involved. Chicago, 80 evacuated. 80 residents from a care home evacuated as workers simply didn't turn up for work. So really remarkably worrying about the most vulnerable in societies here, and Illinois asked for 12,000 body bags, which of course is always disconcerting. So things still increasing in most parts of the United States. There are glimmers of hope in areas like New York that it's starting to level off, but still an awful lot of deaths. But of course we expect the deaths because there's a lag effect. So reduction in number of new cases first, reduction in hospital admissions next, which is roughly what we're seeing in New York now. We're at the reduction in the hospital admissions stage. It's starting to level off. Still very extreme, but starting to level off. But deaths, we can expect that they carry on increasing for a few days, I am afraid, because people die several weeks typically after they present with the clinical features of the disease. Now, just to illustrate my concern about countries with less levels of development, Indonesia, these figures are official. They're official and they're meaningless. There's more burials in Jakarta. Burials in Jakarta are up, indicating that people are dying in Jakarta, indicating that they contracted the disease several weeks ago, indicating that there was community transmission weeks before that. So it looks like a real iceberg situation in Indonesia. And just to underline this, the testing is 0.05 per 1,000. So for the whole country of Indonesia, they've done under 15,000 tests. Not good. Essentially, Essentially, the pandemic in Indonesia is invisible. Very hard to fight an enemy you cannot see, but very, very worrying indications that the enemy is indeed at work in Indonesia. Italy. These death rates aren't going to pan out. There's just so many undiagnosed cases in Italy. Of that, I have no doubt. The real numbers in Italy are way, way higher than this. So we're seeing the severe tip of the iceberg here. It's not going to be as high as that. When in a few years' time, when we do antibody tests on everyone in Italy, we'll probably find out that 20-30% of the population have got it now. And that'll bring that number of deaths way down. So if that number was 10 times higher or 20 times higher, which it probably is, then that number will be 10 times or 20 times lower. That percentage would be that much lower. Testing in Italy is improving. 13.65 tests per 1,000 people. 800,000 tests in total in Italy. And the Italians are talking about being at the peak now. Hopefully things are levelling off as a result of the drastic lockdown measures they're taking, and they're hoping to start ending restrictions in April. But to do that, they're going to need more testing than that, which I am sure the Italian authorities are well aware of. Spain, similar, lots of cases, 150,000 cases nearly, terrible number of deaths. Again, high percentage. Because the real number of cases is so much higher than this, the percentage of deaths for those infected will be less. So that number is going to gradually come down as more cases are identified. And the Spanish authorities are talking about close to the beginning of the decline. So it doesn't mean it's the end. And it's not the, what did Churchill say? This is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning. So things are starting to level off there. So I'm hopeful that this first effort is paying dividends now, and that in Spain we are seeing the end of this beginning period. We're going to need a lot more testing, and we're going to need ongoing lockdown measures, and the easing of the lockdown measures are going to be targeted and gradual. It's not going to be overnight. So perhaps, as in Austria, local shops might be allowed to open, and then see how that goes. But this is not going to be an overnight event. But hopes there in Italy and Spain that things are levelling off. New cases are levelling off. Hospital admissions are levelling off. Deaths take longer, but will start to decline, and the percentage will start to look lower as more cases are confirmed who've had mild disease. France is still increasing, unfortunately. Now, French take their holidays remarkably seriously. Well, we all do, I suppose, but the French take it really seriously, and they're actually using air patrols to make sure people don't go on holiday and stopping cars that are going on holiday. So unfortunately, this is not a time for holidays for most of the world. We can have a holiday later, not just now, too early. Israel, confirmed cases, deaths, low percentage of deaths in Israel. This could turn out to be not too far out. Israel seems to be doing quite well. They instigated reasonably early containment measures. Roadblocks prior to Passover. Passover will have to be celebrated in family units, not multi-generational family units, unless they are in the same household. If you're in the same household, it's fine. If you're not in the same household, I'm afraid you cannot mix with your relatives from other households. Purim was a bit of a mess. There was a lot of public celebrations in the street in Purim, so Netanyahu has said Passover will not be Purim. In other words, this time everyone behave themselves. This is going to be enforced. We're not going to have a bit of a boogie like we did for Purim. Passover is going to be different this weekend. And the lockdown there persists. Now, the last country I want to look at today is the United Kingdom, to illustrate what's going on. Increasing confirmed cases. I do know there's more burials in my area, so I do know this number is way, way higher than this. Again, increased burials in my area means that people died last week, that they became symptomatic weeks before that this whole thing goes back. It means there's community transmission almost certainly in late February. Deaths. This is the highest recorded deaths in 24 hours, making 7,000 official deaths in the UK. Unfortunately, we can expect to see this level of increase for the next few days. So we are looking at 10,000 deaths by the weekend. But these are only deaths in hospital. The people that are getting buried near me, the increasing death rate near me, most of it is not being counted because people are dying at home. So these figures are underestimates. These are people dying in hospital who have been officially diagnosed. I believe, unfortunately, that there's way more people than this dying without diagnosis at home. As in New York, the vast majority of those would have comorbidities. But it doesn't alter the fact people are dying before they should do. My Prime Minister, Boris Johnson, third night in intensive care, described as being stable on standard oxygen therapy and improving, which sounds good. Should be a new bulletin out in the next hour or so. So we mentioned yesterday that the levels of intervention are sort of standard oxygen, giving extra oxygen, giving oxygen with pressure, CPAP, giving oxygen with ventilation, and then the last resort is this extracorporeal treatment where the blood's taken out of the body to be oxygenated. But our facilities for doing that are limited. So hopefully most people are being treated with standard oxygen, as is the Prime Minister, or with CPAP, where the air is blown in to aid the ventilation of the lungs. Now, Wales have confirmed that the lockdown's being continued. The next 3 weeks will be rolled over in the UK, unless I've read this very much wrongly. So the lockdown in the UK, if you're watching in the UK, we can expect an ongoing lockdown. It probably won't be announced this weekend, but it will be. It will be happening. There's going to be a rollover, I'm afraid, because deaths are still increasing. We're doing 14,000 tests per day, which is abysmal. That works out at 3.46 per 1,000 people in total so far. So way behind the curve in testing. We need antibody and antigen testing, as we've talked about many times. Now, it seems to be a complete dog's dinner in terms of antibody tests, because the government correctly ordered millions of antibody tests, but it looks like the blinking things don't work properly. So we've ordered these tests and they're not reliable, and we're looking for a refund. I don't know where we got them from, but it just shows that the antibody tests very often aren't yet up to scratch. We are working on our own, but domestic one's going to be ready at the end of May, which will be reliable. Now, I don't know where these came from. I think the Chinese ones are quite good, and and I know that California has been buying tens of thousands of tests from the South Koreans, which I believe are reliable. But it looks like we've not got these reliable antibody tests yet that we're desperate for. So I think that's all I wanted to say today. I made a note there at the bottom, Corona bonds. I'm not a politician, as I've said, but Italy and Spain basically want to share the financial burden of this all around the European Union. And of course, other European Union countries like Germany and Netherlands don't want to pay all that money. It's a lot of money. So let's just say there's going to be trouble ahead. And I'm going to leave you with a drawing by Matt, which I think is excellent. Thank you, Matt. I wish I could draw like that. He's just sort of sat there and just sketched it. So we've got me on his mobile phone and I'm saying various things. So thank you, Matt. It's always nice to... art is always welcome, especially quality art like this, but it's also good to sometimes to try and lighten the mood a little bit. So thank you.